So whenever you plan to take out any lens due to these reasons mentioned here, you have to take protection of the corneal endothelium, protect the posterior capsule and capsular support, and you have to salvage the small incision so that you do not create unnecessary astigmatism. So it was a case of refractive surprise. Here I am using the good quality viscodispersive, not trying to free the lens from all around. You have to use viscoelastic when the case is for last few weeks. You can easily do it, but in some cases there can be some difficulties. So it's always better to intervene early. And here I am just taking out the haptics out of the bag, first into over the iris. Now just to protect the posterior capsule, I am implanting the lens below that into the bag, so that while I am cutting the lens, I am not hurting the posterior capsule. And at this point of time, I will use Viscot, just no financial interest, to coat the endothelium, and holding the haptic. I am using the Osser cutter, but you can very well use the Bana scissor here. I am just giving partial cut in one, you can say that less than half, then trying to cut a pie here, and this pie will actually help the lens to roll it out from the around 2.8 millimeter of wound without enlarging it too much. So in that way you can do it even without completely cutting the IOL, but you have to take protection of the endothelium so that you don't injure it, because already there is one more lens there. So this it can be rolled out. Another case here, see the lens is out. In the next case, what I am doing that, instead of making any pie, I am just going more than 50% of the IOL optic and cutting it to the 2/3 or 3/4. And even without making any pie, you can just roll it out through the same 2.8 millimeter wound. So there is no need to cut it completely or just make a pie. And here Vanas was used, so that you can see that it will be very handy. This is a case of opacified lens done about 3 years back, so there is a good amount of adhesion of the haptics in the bag. So its idea is not to injure the bag and posterior capsule. So one haptic was easily taken out by some manipulation, but the other one is not coming. So you just don't go on to release it. Rather you can cut the haptic here, so that you preserve the capsular bag. Over that you can implant the another lens. So I am cutting the haptic here and just taking out the lens. So in that way you can just you can save the posterior capsular support to implant posterior chamber lens. Thank you so much.
Thank you, Dr. Subhash, for a very nice and crisp presentation. You have shown multiple ways of removing the lens, and anything can be used depending upon the comfort level of the surgeons. Thank you very much.
See,
The
PMMA, you
PMMA,
can't go, right?
yeah, it will
Even
be difficult to cut.
silicon is difficult to cut. Silicon lenses earlier it was difficult to cut,
No,
but it was
it's,
also amenable to cutting. Yeah, any.